What I want to do in this talk is give you an understanding of the pathology that underlies chronic intestinal pseudoobstruction and severe intestinal dysmotility. I saw my first patient with chronic intestinal pseudoobstruction in 1973, a long time ago, when I was a GI fellow. The patient had been followed in the clinic as psychogenic vomiting. You can relate to that, Mary Angela. And because I had, as a fellow, received training, as a GI fellow, I'd actually received training in pathology by my mentor, Dr. Cy Rubin. I think in terms of structure. If something's wrong with a patient, I want to know what's wrong with the structure. So I started thinking about this patient and wondering, could there be something wrong with her neuromuscular structure of her gut? Then, 1974, I had the fortune to travel to London, where I spent a month working in a neuropathology laboratory and learned the technique of studying the myenteric plexus using a very classical silver stain, which then opened me up to a further understanding of the abnormalities underlying the structure of the myenteric plexus. When I came back, I set up a laboratory, which then carried out research in this area for about 18 years. And I attempted to lay the foundation for understanding the morphology of pseudoobstruction and severe enteric dysmotility. And since then, this has been built on, I think, quite a bit by other people who have followed. And I've made reference to a number of these people in my handout. Since then also, there's been a number of other developments. There's been a lot more understanding of the interstitial cell like a hollow and the role it plays. And there's also been the use of immunohistochemistry, which is a very valuable technique to further understand morphologic abnormalities. So without further ado, let's talk about this. Well, first of all, in terms of what the definition is, this is a clinical syndrome caused by ineffective intestinal propulsion and characterized by symptoms and signs of obstruction, the absence of an occluding lesion of the intestinal lumen. As part of this definition, I think most people would accept that there will be some dilation of the small intestine and the colon, or either one. When there's no dilation, then it's usually referred to as intestinal dysmotility.